Alrighty, so we're going to go ahead as people trickle in, they can join us, but we have a lot to cover today. And so I want to make sure that we have enough time to have the discussion about the new exam. So bear with me 1 second. And, for those of us that work in the office, I do apologize for any background noise, but, it's office day for us at AARP. But I just want to say good afternoon and welcome to the next generation NCLEX preparedness training for nursing students. My name is Jasmine Cooper, and I have the pleasure of bringing you greetings on behalf of the leadership and staff at the Center to Champion Nursing in America. We appreciate you all for taking the time to join us for this important training. Before we go much further, I did want to mention that we are recording today's training. So if you missed a section or would like to pass it on, you can find the recording by going to www.campaignforaction.org/webinars, and we'll make sure to put that link in the chat for you. So next slide for me, please. So I just briefly wanted to share more about the campaign and why AARP has, really have a vested interest in the field of nursing and nursing students in the nursing workforce. So the campaign is an initiative of AARP Foundation, AARP, and the Robert Wood Johnson Foundation. The campaign was launched to implement recommendations in the Institute of Medicine's 2010 report, The Future of Nursing, Leading Change, Advancing Health, which was focused on building a robust nursing profession. Now we are leading efforts to implement recommendations from the National Academy of Medicine's latest report on nursing, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. The Center to Champion Nursing in America, which we call CCNA, runs the Campaign for Action. And like the campaign, we are also initiatives of AARP Foundation, AARP, and the Robert Wood Johnson Foundation. At CCNA, it's our mission to see that Americans have a highly skilled nurse when and where they need one. For the past several years, we have worked with numerous stakeholders in support of mentoring programs at our nation's nursing schools that serve communities of color and underrepresented populations. We provide in-person and technical assistance to nursing schools that serve predominantly Black, Hispanic, and American Indian Alaska Native students and connect them with our coalitions in the states. These goals are to improve retention and graduations of nursing students and increase the graduates' passage rate of the NCLEX. It is through this engagement that with some of your deans and faculty that has provided us with an opportunity to co-sponsor training with the National Council State Boards of Nursing to provide nursing leaders and faculty with the knowledge and skills to prepare schools for the newly revised NCLEX exam. Today, you'll hear from one of our NCLEX trainers, Carrie Barr, who is the Director of Undergraduate Nursing and an Associate Lecturer at the University of Wyoming. Next slide, Carrie. So you can get an idea of who she is. And so to save time, I'm not going to go into her full bio, but I will make sure that it's available on our website along with today's recording. So I want to make sure that Carrie has enough time to go through her presentation. So I'm going to go ahead and say, take it away, Carrie, and thank you all for joining.
Hey, thank you so much, Jasmine. It's a pleasure to be here with everyone. So thank you for having me. I appreciate this opportunity. So as Jasmine mentioned, today I'm going to talk about basically the ins and outs of the next gen NCLEX. So hopefully I can answer some burning questions that you might have, depending on what exposure you've had so far. So before I get started, I do want to give a special thanks to the Future of Nursing Campaign for Action for this opportunity to be here, and also for including me in the training for the Next Gen NCLEX, and to NCSBN as well for putting that training on, and for the use of slides, some of the slides from Jason Schwartz from NCSBN. So, and then some of the slides, of course, are copyrighted, so I want to give a shout out to NCSBN for that. So what are we going to talk about today? So as promised in the registration invite, so I'm going to talk about information on the changes for Next Gen. I'm going to give you some strategies to answer some of those clinical judgment questions. And then we're going to talk about some additional resources that you can further review after this presentation. So why are we changing things? Why now? What needs to change compared to our current practice? So the reason it is time for a change, if you think about what we've been seeing trend-wise over the last few decades, evidence has seen, starting probably initially when the Institute of Medicine kind of shined the light on medical errors and them happening in a way that oftentimes are preventable, and that when patients are going into acute care setting, they're more likely to die from complications due to some kind of medical error that really was preventable. Another reason that things are changing is we have realized the need to kind of highlight on the clinical judgment skills that go into identifying when a patient might be experiencing some kind of complication from their condition or comorbidity, an ability to recognize the cues that indicate that declining status and being able to decide what's going on and how we need to intervene. So basically, we needed to figure out how do we actually measure those thought processes that go into a new graduate nurse, not only a new graduate nurse, but any nurse really, about identifying those things. How do we measure clinical judgment? Okay, so that is what NCSBN set out to do, analyzing evidence and coming up with a model to actually measure this and start to incorporate it into the NCLEX, so that when we can measure whether a new graduate is going to be ready to kind of make some of those judgments and hopefully increase and improve patient outcomes, because I even saw a statistic somewhere that's like there's like 60% of cardiac arrest that could have been prevented if the nurse had noticed the trends and the changes in vitals, the changes in assessments and things like that earlier on and intervened appropriately. So what's the plan? What are we going to do to start to address this? Of course, in nursing education, we do have tasks to do better with that, with preparing our graduates for practice and for making these clinical judgment calls. So for the NCLEX, I do have a link here. If you haven't already taken a look at the new NCLEX test plan, it just came out this month, so it's hot off the presses. So you can look through that test plan, which basically, if you have not looked at that before, is basically your study guide to NCLEX. So what they do, you can go into the NCSBN's NextGen website. You can look at their practice analysis. About every 4 years, they look at where newly graduated nurses are practicing. And then what are they doing in a typical day, in their work? So what kind of activities are they doing throughout the day and how much time are they spending on that activities? And then they kind of translate into that test plan. So you still have all the client needs categories that have been in the NCLEX for the past few years. So that's not going away. A lot of the questions, the standard questions that are directed to those client needs categories are still going to be in the NCLEX. So that is still important. And you'll be able, if you look at the test plan, you'll be able to see what I mean by those categories and also give you percentages. So like the heaviest percentage of the NCLEX is in management of care. And you can see what kind of activity statements go under management of care and what you would need to be familiar with. And then, of course, pharmacology is another one that's pretty heavily hit in NCLEX. So I do encourage you greatly to look at that NCLEX test plan and even use it almost as a study guide as you're preparing to take the NCLEX. Okay, so I said that the NCSBN was coming up with how do we measure clinical judgment? So this is the model that they came up with after gathering evidence and kind of putting this together. So the case studies, that's a big part of something that's changed for NCLEX, is going to focus on this outline area called layer 3 of this model. So we're going to walk through these steps, but basically each case study is going to have 6 questions. And each one of those questions starts with recognized cues and then goes all the way through to evaluate outcomes. And we're going to go through some of these so you'll be able to see that as well. You might be familiar with the nursing process or Tanner's clinical judgment model. So I just want to show you guys how does that line up. So you can see we're still, assessing. So the nursing process, the nurse is still going to assess first. So you're still going to need to recognize cues out of that assessment though. What's suspected? according to why that client's presenting to you. What would be unexpected that might be concerning that you need to intervene on? We're going to analyze the cues that we've collected, and then we're going to say, okay, what could be going on with this patient? So we're going to walk through all of this, but I just want to kind of show you something you might be familiar with as far as the nursing process and then how that compares. So how is the NCLEX now compared to what it has been? So it says NCLEX today, but actually we're now on Next Gen NCLEX that just started in April. So we still have the same time frame. It's still 5 hours long. You still have a computer adapted test, so it will adapt to the test taker and how well you're doing on items as far as figuring out what kind of item to give you next. And it's constantly, as long as you're still getting items on that exam, you're still in the game. Okay, you still have, it's a confidence interval of about 95% of chance of passing. So just take a deep breath when you're taking that test and just keep your eye, keep yourself in the game and try not to get, just try not to get anxious and distract yourself. So the length of the exam has changed. So instead of a minimum of 75 questions, you're now going to have a minimum of 85 and a maximum of 150. So 85 to 150. You're going to have what didn't used to have case studies, so that's new. Everybody's going to have at least 3 case studies. No matter whether you take the minimum or maximum, you'll at least have 3 that are scored. Now you could have as many as 5, but those two out of those would not be scored. Okay. So, and then, like I said, each case study has 6 questions. So you'll have 18 items that go along with those case studies. Standalone items, you can have anywhere from 52 to 117. Those standalone items could be just our general NCLEX items that we're used to, like select all that apply, multiple choice, fill in the blank, like a clinical calculation, a hot spot where you have to click on an anatomical area. So yeah, you're still going to have those types of things. And then we're going to also talk about some of the newer items that you're going to see on NCLEX. And you see, everybody gets 15 unscored pretest items as well. So what might the minimum length of the exam look like? So as I said, everybody's going to get those 3 case studies. So even if you just do the minimum of 85 questions, you're still going to have those 3 case studies. So, and it's going to fall for everybody somewhere. The first case study you're going to see within the first third of the exam. The first third of the 85 questions, I should say. And then the second case study will be somewhere around the middle. And then the third one towards the end of those 85 questions. Okay. All right. So, and then you have some new item types. So again, all the current NCLEX item types that have been on the NCLEX for years now, well, you'll still see those item types. And in fact, the first 85 questions will mostly be those general item types outside of those case study items. Case study items could be any of those new next gen item types. So it could be a multiple response. So you still see there's a select all that apply. There might be a select in, which says like pick 4 out of these. That might be most important. You're going to have matrix grid. That's basically a table where you're going to make choices from. And I'm going to show you several examples of these. Drag and drop. You're going to have some drop down items, highlighting, and then there's 2 special ones called a bow tie and a trend. And so we'll actually practice a bow tie today too. As far as, I do want to point you to a resource that not everybody might be aware of, that NCSBN does put out a newsletter every season. So this is spring 2020. This is the one that highlights the case study. I'm going to give you, there's a slide in here about the new scoring models. There's also a newsletter on that. You can subscribe to these newsletters. They're open access. So I encourage you, that's one of those resources you can look at after today. There we go. Okay, so let's go ahead and look through the different items of that layer 3 clinical judgment model. So after each one of these introductory slides of the item, I'll show you an example. So like I said, that it's going to follow that layer 3. So the first item is going to be focused on recognizing cues. So you're going to be given a scenario on the left-hand side of the screen. And out of that scenario, you're going to need to be able to pick out what is most important out of what I have, the information I have just been given. Maybe what is most concerning, what do I need to focus on first? Okay, so that's all we're doing is picking out what is of concern. So I'm not going to really go through these and answer. We're not going to go through the answers because I do have a case study that we're going to do together, but I want you to see what an item might look like. So this is actually what the NCLEX screen will look like. You're going to have the scenario on the left. You notice you have a tab. So you're going to have a chart. It's going to unfold as we move through this, and you're going to see that. You're going to have new nurses notes that show up with a change in a client's condition. You're going to need to respond to that. So just overall, to set the stage, we have a 78-year-old female client. You can see you have vital signs that are given here. It gives you some assessment findings. And then it's asking you, so here's your item. Select the 4 client findings that require immediate follow-up. So this is a select in type question. So select 4. So we might choose that we want to follow up on the vital signs or the lung sounds, client's orientation. So just for an example, this is what it's going to look like. All right, next item is going to be analyze cues. So now we're looking at the cues, the information we've been given. What does it mean? What could be going on with this patient? What are the cues kind of pointing us towards that are of concern? Okay. So here's the item type that you might see to go along with this type of analyzing cues question. So this is a matrix grid on the right hand side, and it's a multiple response type question. So we still have the same scenario over here on the left, no new information yet. And this is asking us to, let me move this over. Okay, so for each client finding below, click to specify what the finding is consistent with. So it gives us pneumonia, a UTI, and influenza. So when you look at the client finding a fever on the left, then you need to kind of decide, would someone that is presenting with pneumonia present with a fever possibly? If so, you're going to click that. What about a UTI? Yes. Influenza? Yes. So you see how actually all 3 of these could correlate with that client finding. So we haven't decided what's going on yet. We're just trying to make sense of, okay, this information we have, what could it possibly indicate? And you're going to go through each one of these. Okay. You have to have at least one response in each column. All right. So that was the analyzing cues. Next is a prioritizing hypothesis. So now we kind of figured out what's possibly going on. And if we were reading through that whole scenario, we're probably thinking pneumonia at this point. The patient has crackles in the lungs. They've had changes in their level of consciousness, running fever. So that whole scenario, if we read it, would probably point you towards pneumonia. So now considering that, what am I worried about? What do I need to prioritize with a client that's presenting with this type of condition and with the signs and symptoms that were being given? Okay, so what was most likely the explanation, or what possible explanations are most serious? So again, same information on the left. On the right, we have a drop-down item, and it's asking us, the client is at highest risk for developing what? And now you can see your choices. So you're going to choose one of these. And from this, if the client, we're thinking pneumonia, then we're probably worried about hypoxia, right? So we're going to monitor for that. So that would be what we pick. Okay, I'm going to stop there in the middle of this clinical judgment scenario. And I'd like for us to try this out ourselves. And so bear with me. Let's hope I'm computer savvy enough to change screens real quick. So I'm going to stop sharing for just 1 second. Okay. So hopefully you're now looking at the University of Maryland, Baltimore on your screen. So thank you to the University of Baltimore, Maryland, Baltimore, because their faculty have written several case study scenarios and standalone items that are open access. So we're going to use one of these case studies, and let's walk through the first 3 items of what I just covered. All right, so we're given a scenario. I'm going to kind of talk us through the scenario real quick, and then I'm going to pause, and I'd like for everybody to kind of drop what they think the answers are into the chat. So I'm going to pause after I read this. So we've got a 19-year-old wheelchair-bound male who has come to the clinic with his mother for a routine checkup. So at 10 o'clock, we have a nurse's note. The client was received for a routine checkup accompanied by his mother with whom he lives. The client has paraplegia secondary to a spinal cord injury. The client is alert and oriented ×3, denies pain or any problems. The mother is concerned about a red area on his left heel. Vital signs: temperature 97.9 degrees Fahrenheit, 36.66 degrees Celsius. Pulse rate is 76, respiratory rate of 16, and blood pressure 112/68. Lungs are clear, S1, S2 audible with no murmurs, gallops, or rubs. Bowel sounds are hypoactive. Client has full active range of motion in bilateral upper extremities with light touch sensation intact in his fingers. No feeling or movement below the waist. Full passive range of motion bilaterally in lower extremities. There is an open area noted on the left heel with a foul odor detected, but the skin is otherwise intact. Okay, so time to put your thinking cap on. We're recognizing cues. So which of these cues, or which of these findings are of most concern to the nurse? And this is a select all that apply. So that you should approach a select all that apply question if you don't already know this, that you should consider every single option true or false. Okay, and I do recommend you also read these scenarios very carefully. So please drop in the chat and tell me what you think would be the correct answer. I'll give you a moment. All right, so I'm just kind of scrolling through the chat here. All right, yeah, good job, y'all. Okay, so if you chose, so I'm going to go line by line like I was answering this question as a test taker. Okay, so bowel sounds. I want you to ask yourself, is this expected or unexpected finding in someone with paraplegia? Would you expect that we would possibly have some hypoactive bowel sounds? Okay, so I'm going to say as a test taker, I know that that's actually a common finding with someone with paraplegia, so I'm not going to pick that. Okay, open area on the heel, is that expected? No, it's not. That's an alteration and a complication that we know can happen for someone that is not able to have active range of motion in their lower extremities. Am I worried about the range of motion? I expect that for someone with paraplegia, plus he has full passive range of motion. What about his blood pressure? Blood pressure is 112/68. That sounds normal and stable to me. Light touch sensation in his fingers, that's good, so that's normal. Foul odor, that's not good. That means that can indicate infection, right? So I'm going to choose that. And then am I worried about absence of feeling below the waist for someone with paraplegia? No, I am not. So let's go to the next item. So now we're going to analyze. Let's see if we got any new information up here. So it looks like we still have the same information. So now for each potential finding, click to indicate if the finding is consistent with pressure injury or venous stasis ulcer. So what do we think is going on? So we're going to look through each one of these client findings. So I'm going to go through each one of those and you tell me whether you think it is associated with pressure injury or is it associated with venous stasis ulcer or both. So what do we think? Immobility. Would that be a finding that we think could indicate that the cause of the wound is due to pressure injury or venous stasis ulcer or both? So feel free to drop that in the chat. You guys are on top of it. Good job. Yeah, so if we're immobile, then the venous blood is just kind of sitting, right? That's when we want to get our patients up and moving as soon as possible. So good. Immobility certainly could indicate a venous stasis ulcer or a pressure injury. What about inadequate calf muscle function? Pressure injury, venous stasis, or both? Very good. So yeah, that calf muscle is the pump that keeps that venous blood moving. So that would not, result in a pressure injury, right? But it could result in that pulling of the blood down in that lower extremity. So it could cause a venous stasis ulcer. Let's go to located over bony prominence. Pressure injury, venous stasis, or both? Yeah, definitely. Good job. So a bony prominence is definitely where we're going to look at typically to find if someone with immobility. We're going to look at those bony prominences in particular because that's the sites that tend to get pressure injuries. So good job. All right. What about surrounding skin is brown and edematous? Nice, you guys are on it. So definitely venous stasis ulcer, that's kind of a cardinal sign. You're looking at the surrounding skin, it's brown, it's edematous, it's got that hemolysis going on that's staining the skin. So yeah, that's definitely associated with venous stasis. Shallow wound, that be pressure injury, venous, or both? Good. Yes, that could be both of them. They both could present as a shallow wound. And then lastly, tissue ischemia. Okay, so I see a lot of us are saying both here. So I would say I would think this through so ischemia, if I'm thinking of a peripheral vascular disease, I would actually put that more with an arterial ulcer than I would a venous ulcer. So yeah, I think the ischemia tends to be more with a pressure injury, if that makes sense to you. So awesome. Let's do one more and then we'll get back to the presentation. So we now have some new information. So at 10:15, there's a new nurse's note. So they've done some measurements of the wound, measures 3.5 centimeters by 4 centimeters by 0.5. There is no undermining present. The wound bed is pink. There is some slight foul odor detected, but there's no drainage. The skin surrounding the injury is pink, warm, and dry, and the provider and wound nurse have been notified of the wound. So here is going to be a drag and drop type question. So it says to drag the most appropriate word from the choices to fill in the blank of the following sentence. The nurse should recognize that the client is most likely experiencing a, what do you all think? Stage 2 pressure injury, stage 3 pressure injury, stage 4, or a venous stasis ulcer. You got it. So I'm going to drag over the stage 2 pressure injury because it tells us there's no drainage, the wound bed is pink, surrounding skin's pink, warm, and dry. So that's a stage 2. Stage 3, we would expect that there's going to possibly be some fatty tissue that's visible in the wound bed, and there might be some drainage from that one, things like that. So good job. Okay, we're going to come back to this. So I'm going to stop sharing, and let's look at the rest of we're all looking at the same. Nope, we are not. Just one moment. Okay. So let's look through the rest of this case study. So we've got 3 more items. So we have, just to review, so far we have, I'm going to give you whiplash for a second. We have recognized cues. We've analyzed those cues. So what could it mean? We've prioritized our hypothesis. So far we think it's pneumonia. We're wondering, we're worried about hypoxia. So we're prioritizing this hypothesis that way. And then let's talk about what can we do now? All right, so we need to generate some solutions based upon our hypothesis. So what are some desirable outcomes that I want to aim for, and what kind of interventions could I do to obtain those outcomes? And then what might be contraindicated or that should be avoided. So here's our next item. So you see we now have a new nurse's note on the right at 12 o'clock. And this is asking us about the nurses reviewing the nurse's note from 12 o'clock. This is another matrix grid example. And this one is a multiple choice. So basically, you're either going to choose whether it's indicated or not indicated for each client finding. So for each potential nursing intervention, let's click to specify whether it's indicated or not indicated. So you're going to need to pick one or the other, right? So whether we're going to prepare for defibrillation, and if that's not indicated because like she's got atrial fibrillation, but we don't know if that's like a chronic thing. Her pulse rate's 92, her blood pressure, sorry, let's go down here. Pulse rate's 112, blood pressure is a little low. But yeah, not necessarily indication for defibrillation here. So you're just gonna think through each one of these and just choose the correct response. Yeah. And then we're gonna take action. Okay, what will we do? So we thought about what we could do. Now what are we actually gonna do? Okay, what intervention is going to be most appropriate and what's going to be my priority? So we don't have any new information yet on the left, but we do have a set on the right. We have a new tab of orders. So we have received a set of orders and this is a highlighting item. So we're supposed to choose what would be considered priority. I want to point to you though, it does say orders, right? So it's plural. So we need to highlight more than one item. So this is just an example. When you're reading through this stuff, pay close attention to some of these defining keywords, right? So highlight the orders. Okay, so here we can see that there's three things that were highlighted. We want to give vancomycin. We're going to give a saline bolus because of the low blood pressure. And then we're also going to get some lab tests before we start that antibiotic, right? All right. So we've intervened. Now what? So this is the last item on the case study. How did it go? We're evaluating our intervention. We're seeing how is this patient status changed, and then what is indicating that they're improving versus what is indicating that they're possibly worsening or not changed. So you now see on the left-hand side, you got two tabs. You got the nurse's notes, you got the orders, and then you got a matrix grid with multiple choice. Okay, so for each row, you're going to need to choose one response. So you're going to look over here, pale skin tone, is that it showing? So is this a sign of improvement, not changed or worsened? I would say not changed. Respirations are 36. Well, they were 32. So that's worsened, right? So I would click worsen there. And then the last thing I'll look at is blood pressure is 118/68 and it was 90/62. So now that's showing a sign of improvement, right? So you can see the other tab here. So you will be able on the in the test, you'll be able to click on the tabs and you'll be able, the information follows you. So you still won't be able to backtrack through these questions. Once you hit that forward button, you won't be able to go back. Okay. Trust your instincts. Don't change your answer because you're second guessing yourself. Okay. Don't read into these questions, just like with normal NCLEX. Okay. All right, so let's go back to our case study and we're going to finish that one up. Okay, so hopefully y'all can see my screen again. So we're going to go to this next question. So let's see, do we have more information here? We do. We have a new nurse's note at 10:30. So now we see that the wound nurse is visiting the patient and they have assessed the left tail wound. They do confirm it's a stage 2 pressure injury. Good job. All right, so for each potential order, we're going to click to specify whether the order is indicated or contraindicated to include in the plan of care. So back to the chat. Let's go one by one. Debride the wound. Is that going to be indicated for a stage 2 pressure wound or contraindicated? Yeah, good. Yeah, we're going to say it's contraindicated because there's no indication that there's something that needs to be debrided in a wound bed that's nice and pink, right? All right, leave wound open to air, indicated or contraindicated? What would leaving this wound open to air do? Good job, everyone. Yeah, that's contraindicated. We want to protect the wound from mechanical injury, from other bacteria, germs getting into that wound bed. We want to also keep a moist environment, so that's good. What about leads to infection? Good job. Hydrocolloid dressing, indicated or contraindicated? Yeah, if you're not familiar with what a hydrocolloid dressing is, it actually might be a brand. Oh, no, well, no, it's not a brand name, but if you're not familiar with it, it's something like this comes up when you're studying. Make sure you look that up as one of your medical terms just to be familiar with, okay? So yes, a dressing, nice hydrocolloid dressing is indicated. It's going to protect the wound bed. It's going to keep it moist. So great. What about clean with saline? What is the cleaning with saline going to do? Indicated or contraindicated? Yeah, it sounds like a good idea to me. Let's clean that wound. It's not caustic to the wound. Saline's a pretty easy way just to clean out any kind of debris. And then we can dry and place the hydrocolloid dressing. What about IV antibiotics? Does this seem like the situation that needs to be addressed with IV antibiotics? Good job, everyone. You're good antibiotic stewards. I agree. Contraindicated. There's no indication that we're ready to pull out some big guns with IV antibiotics. Good job. Let's move on to the next question. So now we have orders here. So our orders are cleanse the left heel wound with normal saline and dress with hydrocolloid dressing, and have the client to return in 2 weeks for follow-up. Okay, so the nurse receives these wound care orders. What 3 actions should the nurse teach the family about wound care? So this is, we're looking for 3, right? So this is a select 3, select in type question. So which 3 items should we teach the family about? Should we teach them to wash their hands prior to performing the dressing change? Gosh. What about massaging the right heel each evening to promote blood flow? Is that a good idea with someone with a pressure injury? Monitor for signs of infection. Should we monitor for signs of infection? What about elevating the heels when in the bed? Would we want to keep their heels off the bed? See how I reword that right there? It doesn't necessarily mean that we're trying to promote venous return or anything. It means that we're trying to get those heels off the bed, right? Eat a diet high in complex carbohydrates. What's that going to do? What do we usually want to encourage a diet high in for wound healing? I think we all immediately go to, yeah, protein. Good. And then applying a cold pack to the wound as swelling occurs. Is that a good idea for someone with a pressure injury? What is that going to do possibly to that wound, the area around the wound? Probably not a great idea. Yeah, it reduces blood flow. Yeah, so it's actually it's going to reduce perfusion there. So yeah, everyone did a great job here. We're going to encourage them to wash those hands, monitor for signs of infection, keep those heels off the bed. So Great job, everyone. So last question. So now we just need to see, are they getting better? Okay, so we have a progress note here. They're seen in the clinic for follow-up of a stage 2 pressure injury diagnosed 15 days ago. The wound now measures 3 centimeters. I don't really remember what those measurements were before, but 3 centimeters by 3.7 by 0.2. Actually, here's the measurements right up here at the top. So we're still able to see that same information. So you can see that that wound actually is getting smaller. No odor, drainage, or signs of infection, and the skin surrounding the wound remains pink, dry, and intact. So client returns to clinic, we're assessing, and the nurse determines the client status is what? Are we improving, deteriorating, or unchanged? Yeah. Sounds like it's getting better. The foul odor is gone. The wound is getting smaller, and everything like surrounding it is still intact and pink and dry. So now, what should the nurse do? Should we call the wound nurse to recommend a change in the treatment plan? Do we feel like this, we need to change the treatment plan? Do we think we need a vacuum assisted closure system? Or do we want to reinforce the interventions that are already in process? Bingo. Good, Yasmin. Yeah, it's working. So we just want to reinforce it. There's no indication that we need to change a treatment plan. Like, why change something that's working, right? So great job, you guys. So you all, that is your case study. Okay, so hopefully not so intimidating. If it was intimidating, maybe it wasn't. But let's go back over to our presentation. So yes, I would say that, so I will point you towards, again, that NCSBM website has a whole sample packet of case studies. So take a look at the, download that sample packet, go through there, just go through and practice. I will tell you, if it makes you feel any better, that my students that have gotten some of these items, they say they actually like them better. Because it's much more realistic of what it's like, you know, what the thought process is that a nurse does when they're taking care of their patients. And then just to summarize, remember, recognizing cues is just what matters most, analyzing the cues, why does it matter, and what's possibly going on, prioritizing hypothesis, where do I start, what kind of complications am I worried about, right? Generate solutions, what would be indicated versus contraindicated, what could help right now. And then, okay, I've done brainstorming, I'm ready to take action. So what's going to be my priority, possibly? And then evaluate outcomes. How did it go? What interventions I did that work or not? Do I need to change my focus? All right. Just very briefly, I would like to talk about the change in the scoring. So again, this is a newsletter. I'd invite you to go and look at the full newsletter on the NCSBM website, but I did just pull out this graphic they had about the scoring models. So for the next gen items, so they have a 0-1 scoring, plus, minus, or rationale. So 0-1 scoring means that you'll get a 1 point for the correct response. You won't get anything for an incorrect response. So the total points are just everything that you got right. Okay, so then in that scenario, you're not punished for picking an incorrect answer, but you do get points for the ones you get correct. And that's opposed to the plus minus scoring, which you get 1 point for each correct answer. However, each incorrect answer, you get a point subtracted. So then it will never go below 0. So whatever your total sum is of your points, that's going to be your score on that one. And then lastly, the rationale. You saw the item where it had just the 1 drop down. There might be an item where there's 2 drop downs and they relate to each other. So in order to get that question correct and full points, you need to have both of those drop downs correct. Okay, if one of them's wrong, you won't get any points. Okay, so that's the change. Those are the next gen items and how they're scored. And yeah, just if you're wanting more information, go and take a look at that newsletter. Okay. All right, let's look at some other items that you might see on the NCLEX. So other next gen items. So we already saw one that was a highlighting item. And basically you can see how you're looking, you're trying to figure out, okay, what requires follow-up? Well, and I'm worried about appetite. What if I just click on appetite? Well, it's going to highlight the whole thing. So as long as I choose or click on one of these words here in that, it's going to highlight the whole thing. Okay. So this is a highlighting item, pretty straightforward. Pull down menu item. So this is the one I was talking about, the rationale scoring. You see there's two options here. So the nurse should first address the clients, pull this down, choose their appropriate response, followed by the client's next, whatever else. So maybe it's the client, the nurse. So what's the priority, right? This is basically a priority question. The nurse should first, that's your keyword right there. First address. So what's my priority thing to address? Maybe it's abdominal pain. We don't know what the scenario is, but followed by the clients. And then you're probably going to have the same answer option. So it might be lab tests and that sort, but you need to get both of those correct. So we saw these in the case study. So this is a matrix grid multiple response. You see, you either are going to choose, actually it's multiple choice, sorry, anticipated or contraindicated. One or the other you're going to choose, okay? So you had to choose one for each row, all right? So that's a matrix grid multiple choice. This is just another example of the same thing. Notice that these are circles. That's just like a little hint that those are the circles are the ones that are multiple choice. And then the multiple response are squares. That's just a little thing that I noticed. So and then this should look familiar where you have the three different conditions, and then you might choose fever for all three of these. So that's why it's a multiple response. Drag and drop. We haven't seen one of these yet, but here they're asking us to find 4 client findings. And then so we're going to choose from this list over here on the right. We're going to click on one of them. We're going to keep clicking as we drag it over here to this right hand side, and then let go of the clicker, and it's going to drop it into these top 4 findings. So right, so those are the next gen items type items that you could see. Any of those could be utilized in the case study. Okay, so now let's talk about some standalone items. So there's something called a trend item and a bow tie item. If you take the minimum length of this exam, 85 questions, then you are only going to, you're not going to see these items. Okay, they are only going to show up after you reach the 85 mark. So if you get past 85 and you're still taking questions, you are in that game. Okay. So you might start seeing some of these cool items. So these are also considered the trend and the bow tie are also clinical judgment items. That's also what these 2 items, as well as the case study, are what's measuring clinical judgment. So the trend item is only measuring like one item on that clinical judgment model in the layer 3 that we've talked about. So here you can see that we have notes from multiple weekly visits. So different days, different times, and you can kind of see that this patient is kind of not doing so great. So then we have to look over here and say, hey, what should I anticipate the physician might instruct this parent to do, okay, to help this client. So, and then we're going to drag and drop in, okay. So, and this, this is not one of those rationale ones. So we would drag, maybe we want to fortify the breast milk. So we're going to drag it up, but we only have 2 options. So we got to pick the best 2 options from this, okay, based upon this trended information. So that's a trend item. And then we have a bow tie item. So this one is more fancy even. So again, you have this scenario on the left, okay, so as opposed to a trend, you have one nurse's note over here. And then it tells you, after you've reviewed this data, you're going to prepare a client's plan of care. So you're going to start first in the middle. So this is a bow tie. So what do we think is going on? So what potential condition based upon this information on the left do we think is happening? What's most likely? So whatever we think it is, we're going to drag and drop that into the middle. Then we're going to go to the left. So middle, left, right. Okay, so we're going to go to left. Considering what we think is going on, what would be the most appropriate actions to take? We need to choose two of these. So we're going to drag whatever two we think into these actions to take. And then we're going to come over here and say, what are we going to monitor this patient for? So what's going to tell us that they are improving or deteriorating? What are we going to monitor to know that what we're doing is working? Okay, so this bow tie actually assesses all 6 elements of that clinical judgment model. All right, so let's do one more activity. So I'm going to stop sharing again and let's do a bow tie item together. Bear with me as I pull that up. Okay. Share my screen again. So we got another item written by University of Maryland, Baltimore. So let's take a look at what they've got. So, they don't have it set up like the bow tie I just showed you, but that's okay. It's the same thing. Okay. It's just that it will look like the bow tie in the NCLEX. All right. So let's just read our scenario. So I'm going to read this out loud and we're going to answer this together. So we have a 23-year-old male in the ED who is experiencing acute onset of shortness of breath. At 11 o'clock, the client reports shortness of breath and chest tightness that's progressively worsened. And that's the key for the past 2 to 3 days. He's had a history of seasonal allergies, non-smoker, and lives at home with his mother, who is a current smoker. Denies fever or vomiting, describes feeling fatigued and has a dry cough at night. 11:15, we now have a new note. Audible and expiratory wheezing is oscillated throughout the lung fields bilaterally. We now have an increased respiratory rate noted. CAP refill is still okay at less than 3 seconds and skin is warm to touch. Chest wall symmetrical with no deformity. The client is sitting upright and leaning forward with his hands resting on his knees in tripod position. Can only speak a few words between breaths. I'm kind of worried about this guy. Tenderness on palpation of chest wall, but the trachea is midline, so that's great. No deviation. Labs are drawn and chest X-ray is ordered. Now at 12:30, there's an ordered bronchodilator and a corticosteroid therapy treatment that has already been completed. However, the client is experiencing extreme labor, breathing, confusion, and increased heart rate. Blue tinged lips, prolonged expiratory wheezing with chest tightness on assessment, and reports having difficulty catching a breath when lying down. You're given some vital signs here. Notice the times at the top: 11 o'clock, 11:30, 12:30. You look at trends. Just as a nurse looking at patients, we want to watch the trends, and that way we can identify a problem early, hopefully, right? So we can see this guy is deteriorating. Look at his pulse rate, his respiratory rate, blood pressure is going up, and the oxygen pulse ox is going down to 85% on room air. Our orders are to monitor the pulse ox continuously, administer 2 liters of oxygen as needed by nasal cannula to maintain O2 levels greater than 93. Give some albuterol every 1 to 4 hours as needed for shortness of breath. Ipratropium inhalation every 6 hours as needed for shortness of breath. That can be given with albuterol. Place peripheral IV and administer Solumedrol 125 milligrams IV stat once. Instruct the client on peak flow meter use for at least 2 times daily. All right, so those are our orders, and we also know that the bronchodilator and corticosteroid therapy was completed. So what do we think is going on with this patient? So remember, I said we're going to start in the middle of the bow tie. So what do we think? Which of these conditions do we think this client is experiencing? Go ahead and drop what you think in the chat. So what do we think is anaphylactic reaction? Is it bronchiolitis? Is it status asthmaticus? pulmonary edema. Yeah. So that, I think you are correct, is going to be status asthmaticus. What were some cues that pointed us to maybe asthma? It talks about the chest tightness progressively worsen. Seasonal allergies, is that a risk factor for possible asthma? Living with a smoker at home, is that a risk factor? And then he has this dry cough at night. That's kind of a cue right there that something's going on. And then, yeah, you've listened to the lungs. You've got expiratory wheezing. You've got some cyanosis. He's in the tripod position. So this is getting worse and worse, right? So this is asthma. So if you're not familiar with asthma versus bronchiolitis, you might want to go and do a comparison of those two. All right, let's talk about what we want to do. So we're ready to go to the last side of the bow tie, actions to take. Should we obtain a sputum culture? We're going to pick two. Should we suction his airway? Should we administer epinephrine? Administer high flow oxygen? Or administer a diuretic? What do you think? Yeah. And looking back at what's going on up here, oxygen was 85% on room air. Do we want to possibly provide some oxygen? I think we all agree on that one. What else? Let's look at how he was last time we got an assessment on him. He is now extremely labor breathing. He's confused. That's a sign he's not getting oxygen to his brain. Increased heart rate, blue tinged lips. This guy is in serious trouble. Okay, we've already given bronchodilators and a corticosteroid. So besides oxygen, what is going to help? Because listen, his airway is tight, tight, tight. What can we give to open that airway up? Good, you guys. Yeah, that's going to be our next intervention. We need to get some epinephrine because he's now in serious condition, and we need to intervene with something that's going to get that airway open so that oxygen can get to where it needs to be. Great job. Last bit. We got two more. So now what are we going to monitor? So we've taken action. We know it's epi. Okay, so someone asked, even if it's not in the orders. So that's a rule of thumb on NCLEX. If it's an option to choose from, then you've got an order for it. Okay, so just assume that you can do it. Okay. So what are we wanting to monitor now? So do you want to monitor, how are we going to know that these two things we just did worked? I think that's the best way to put it. Yep, there you go. We wanted to get that airway open, get some oxygen on board. So let's watch the oxygen concentration and the respirations. Great job. So that's a bow tie. So great job, everybody. I just say, like, practice, practice, practice. You're the more comfortable you will feel with these things. You're doing a great job at picking out keywords. Make sure you do take your time to read your question slowly. Don't rush through. Don't stop in the middle and say, oh, I know what it's asking. Read it carefully. There are going to be keywords that point you in the right direction. And then everything, all the information that you're given is what you had to deal with. And yes, anything, any medication or order, you assume that you have that order. So what are you, as a nurse, you need to choose what's appropriate, right? Good. All right, so just a little bit of a wrap up here. I've got just about 15 more minutes, and then we're going to stop for some questions and answers. So I did just try to collect some best advice for you. You're about to graduate and you're going to be taking this new NCLEX exam. I want you to know that it has been, there are a lot of students that are taking these type of exams are feeling good about it. They're still able to complete it within the same time frame as they would the old, old style NCLEX. We're anticipating the same outcomes, as we've been having, maybe even better, who knows? Okay, so some key takeaways. The closer to graduation that you take this NCLEX, the more likely you are to pass. Okay, just take a look at these declining pass rates for test takers that are testing after 90 days. Evidence shows that your likelihood of passing steadily goes down the longer you wait. So that being said, hopefully you're going ahead and you're starting to prepare now if you haven't already. And the best thing you could do is practice questions. Okay. So depending on what resources you have, you might have resources that you already have access to from school. So use those resources. There might be some free things online. So NCSBN does have a sample exam out there. I think it's around, no, don't quote me on this. I think it's around 150, 170 questions. Now they're all traditional NCLEX style questions, but still, remember, a lot of the questions on the NCLEX are still going to be those traditional questions. So you still need to practice those. And then, spend about 2 hours a day practicing questions. But even if you only do as few as 20 questions a day, just really take your time with them. Pay attention to what the rationales say. Why is that the correct answer? What's the rationale for that correct answer? The more that you do this, the more confidence you're going to get, the more likely you're going to be able to read these questions, you're going to feel comfortable with them, and that you're going to be successful on NCLEX. Okay. Test taking tips. So if English is your second language, I did do some research on this. And so what I was finding is that they do recommend practicing those questions in English, because if you are interpreting them back and forth between languages, there's some things that may not translate, and it could cause you to miss the question. So as much as possible, maybe sit in front of a mirror, just talk out loud, read the question out loud like I did. And then, just try to practice that in English. Like I said, read the questions all the way through. Look for those key words that could kind of point you in the right direction. So look for words like first or primary. What are you going to do first? What's the best action? Think about what it really is asking you. Okay, don't add to the question. If it's not there, don't add it to it. Okay, you have knowledge. You're about to graduate from nursing school, so you do have the knowledge. Okay, you need to give yourself that confidence to say, I can do this. All right. So what you just need to do is practice. And of course, there might be gaps of where you're not as strong. Hopefully you're getting some practice questions in your programs that you can identify some gaps. When you're answering questions, if you notice like there's a certain category that you're kind of missing a lot, maybe that's where you go back and just like kind of pointedly study that, just look over that content and then go back and answer questions based on that content. And I do want you to pay attention. It is important, the pacing of how you're answering questions. If you're somebody that goes through the test like super fast and you're done, you need to slow down. And that's evidence-based, okay? If you're somebody that takes too long, like you need to work on improving that, which will help with practicing, right? But just work on pacing yourself. NCSBN, they recommend 1 item every minute or 2. Okay. Medical terminology. A lot of my students tell me that they get messed up, so to speak, with some of the medical terminology. So I also want to share, there's a tutorial that Medline Plus has, it's Understanding Medical Words. So it's a whole tutorial on all these medical terms. And then so Appendix A is what I really like, because this is the word parts. And I found that throughout my, just being a nurse, there's still things that come upon, and I'm like, what is that again? But if I can pick it apart, so if I know what peri means, that means around something, right? Surrounding something. And I know like a root word is card. So that card means heart, cardio. That's relating to the heart. And itis is referring to inflammation, then pericarditis, even if I didn't know what that term was, I could figure it out. I could figure out that that means there is inflammation in that sac surrounding the heart. Okay, so you see how that works. So if that is something that you struggle with, probably practice and review some of those word parts that can help you dissect just like that. Okay, and then you also should be familiar with NCLEX terminology. This is a direct screenshot off of the test plan. So again, I'm going to point you back to that NCLEX test plan to look over and understand the information that's provided in there and really help you. So there is some NCLEX terminology you want to be familiar with. So when I say patient, so because I kind of fall back into that, whether I mean to or not, they say client. So a client could be an individual, a family, or a group. Okay, so it could be an individual or a population that is a client instead of a patient. They will refer to something, an intervention, as an order from a primary healthcare provider. Instead of a medication order, it's going to say prescription. Okay, so that's the terminology, and that's an updated terminology. So prescription is what you're going to see as a medication order. Okay, and then primary health care provider, that could be anybody that's licensed, authorized to formulate prescriptions or orders. So that's all encompassing, you know, a physician, a nurse practitioner, a physician's assistant, you know, any kind of specialist. And then unlicensed assisted personnel, depending on where you live, it might be called something different, but it might be just a nursing assistant, or someone that's working in the, you know, unit secretary, something like that. So unlicensed assisted personnel. Okay. Lab values, a lot of people have questions about whether they need to memorize lab values and which ones they need to memorize. So I also have a link to the nursejournal.org that talks about NCLEX lab values. So just so you know, in the case studies, it's going to give you, so it'll give you like a tab with lab values. And just like if you were looking at it as a nurse in the acute care setting, it's going to give you the normal ranges. Okay, so in the case study, you will be given those normals. In the standalones, so the individual items outside of the case study, you'll be expected to know the normals. You will not be given the normals then. So this article, this link there, it tells you what NCLEX focuses on, most of the lab values that it focuses on. So that'll at least give you somewhere to focus in, and make sure you remember those normal values. So just remember, you can do this. Confidence is everything. I know a lot of people struggle with anxiety with test taking. If you need accommodations, don't be afraid to ask for those. Okay, you can contact your board of nursing and request accommodations. That would be the first step of contact your board of nursing and see what the process is in your local area. You know, just get plenty of sleep, take care of yourself. Self-care behaviors are important for nurses anyway, so hopefully you're doing that now. And then the week of the exam, don't be trying to cram information. That's not the time to do it. You have already studied, you are prepared, you've got this. At that point, just try to, you know, enjoy yourself, time with friends, go for a walk, just whatever fills your cup. All right, so these are the resources. So this is the slide that you can go and download my slides, and these are links into some different resources that I have referenced. University of Maryland also does have something called a mini review that you can download, and it has like a bunch of different case studies and bow tie questions that you can practice. Okay. And that is it. So this we could, we are joined, believe we're joined by some other people that were with me in the training in DC with Jason Schwartz. So they're here to help me with questions and answers, and I would love for them to take it away from me because everybody's probably tired of hearing me talk at this point. But I do see, let's see, just a couple of questions. The practice exams, yeah, on NCSBN's website, it's free. Yes, it's open access to everyone. And I believe Jasmine said that there's going to be a link to the slides. that right, Jasmine?
Yes. So everyone who registered, I'll be sure to send you an email once the video, the recording, as well as the presentation and all of these links become available. So my goal is no later than Monday, you should have an email from me with this recording link and access to all of these resources.
Thank you, Jasmine.
Carrie, this is Mary Martin.
Hi, Mary.
Hey, so I see a question in the chat as well. Is the test going to give us a warning when we need to open tabs?
That's a good question. I don't believe it's going to give you a warning, but it won't let you move forward without answering a question. So it won't allow you to skip it. Does that make sense? So if there's something that you've skipped because you didn't see that extra tab, it will prevent you from going forward. Does that make sense?
I think I also captured a few. There was a question that came up about partial credit. And so when we were doing kind of one of the questions that asked for 3 answers or 3 responses, the question is, if you get 2 right and 1 wrong, do you get partial credit?
So that's a great question. So I would point you towards that scoring model newsletter. So it depends on whether they use the 0, 1 or the plus minus. So in that example, Jasmine, that you just gave, so there's 3 options and you pick 2 that are right and 1 that's wrong. So let's think that through. So if it was a 0, 1 scoring model, what would be your score? Yep. Because remember, 0, 1, it's just you don't get penalized for an incorrect answer. You just don't get points for it. So it'd be 2. And then if it were a plus minus scoring model, then you would actually lose a point for the incorrect answer. So then that would mean 2 minus 1, and then you get 1 point for that question. And will the question indicate what the scoring model is? I don't believe so. I'm pretty sure, like, traditionally it doesn't, but we would have to ask Jason for me to answer that for sure.
And we can reach out to Jason and follow up on that question, Peggy.
Oh yeah, and Peggy asked, is it better not to answer if you're not sure? Actually, answer every question and use an educated guess. If you look at that and go, I have no idea what presbycuspis is, for example, that's one of those terms that sticks in my head that I'm like, I had to look it up the other day. But you might be able to go ahead and read that full item and read the answers, because sometimes the answers can point you to information in STEM that is going to help you interpret what that is asking. So sometimes I may not even need to know what presbycuspis is to answer the question. So it's better to make an educated guess than do nothing at all. And like I said, the NCLEX, it won't let you not answer a question.
I meant in those scenarios where you risk losing a point, you know what I mean? So if I'm sure about, these 3, but it could be 4, is it better not to answer instead of risking losing the point? Because you're going to get the credit for all the right ones you answer, correct?
That's a good point. Yeah, I think you make an excellent point there, Peggy. And so in that scenario, I don't know, I would want to defer to Jason, but personally, yeah, I think you have a great, I mean, if you're not sure about it, but you're really sure about those other items, then yeah, you probably don't want to pick the one that you're guessing yourself on.
Right. I would like to add that the newsletter Summer 2021 has example of 0, no points, 1 point, and they use multiple choice. So that newsletter has which type of questions has, delete a point or none.
Thank you so much.
You're welcome.
I may have missed it, but how do we subscribe to the newsletter?
Yeah, so it's if you go to Next Gen NCLEX resources, it should be in their resources, I believe.
Okay.
Yeah.
And I did give a couple of direct links to, I think, the scoring one and the case study one in that one slide.
Right. Thank you.
Yeah, you're welcome. And so looking.
For an informative, interactive presentation, thorough. I would like just to share briefly some strategies that maybe educators can use to get them to the point of where you did your presentation, which was lovely. And that is possibly looking at the work of Chateau et al. 2017. And one of the findings was that if the students are exposed to at least 3 simulation experiences, that could help develop or reinforce clinical judgment. And then the other is Sumner's work, 2021. And this is really interesting. It's asking the educator to ask the students to respond using evidence-based information. And that will give the educator an opportunity to evaluate the students of how they're doing. And then the last strategy is using the Socratic method of asking probing questions, insightful. And it talks about clarification, such as, what did you find? What are the assessment findings? And what's the priority? Then the second part of that is justification. Why did you look at that particular data, the lab work? Why did you do that? And then lastly is probing, what are the implications? For instance, if you're looking at real brief cardiac chest in the pain, pain in the chest area, is it cholecystitis? Is it cardiac? So you're asking, if you go down the road of cholecystitis, what's going to happen when it's really cardiac? So it's asking them to think more, and that can lead to deeper thinking and hopefully clinical judgment.
That's awesome, Marion. I'm writing that down. Good tips.
And I want to make sure we didn't miss any other questions. Andrea, she said there was a question regarding priority for the tib-fib fracture versus the hematoma in the neck. I think I missed that question. Andrea, are you available to ask that, or who? I'm not sure who asked it in the chat. We had a lot going on.
It was me.
Okay.
Yeah, we reviewed some questions, but we didn't have any answers, and everybody was kind of confused about. It's been bothering me for several weeks now, and I just wondered if she could review that, or someone could review that.
And was that the
Yeah,
case
priority,
that
tib fracture versus a femur fracture in the ER versus a hematoma in the neck.
So is this a question, Andrea, that you got like when you were practicing?
Yeah, but we didn't have any answers, so we were all just guessing.
To me, you would look at your clinical data that you're assessing. Are they stable? Which one of them is unstable? So that's going to be your priority. Is your tib fib, are they bleeding out? Are they going into hypovolemic shock? Are they,
Yeah, it didn't
with
say.
the hematoma, is it pressing on the, carotids or the jugulars? Are they have any kind of altered mental status? So
Yeah, none of that data was given. It just, one was an open tib fib and the other was a hematoma in the neck. And it was like, I don't know.
Okay, Andrea. So this is where I want to say sometimes there's not the greatest question. Okay. And when there is that, we kind of have to do our best and move on and let it be. So if there's one like that you're just stuck on, and you're just like, so like, I don't know, maybe it didn't give you the information you needed to make that judgment. Just as Mary Martin was just saying, like that, some of those clues that would have told you, oh, hey, that's my priority. I know that their decompensation, I'm worried, I need to intervene. But yeah, so it just might be that it just didn't provide that for you. So I would say deep breath and maybe let that one go. And maybe rewrite it. That would be my suggestion. How about you try to rewrite it and give some indication of which one would be your priority and why?
Okay, thanks.
Yeah. Someone asked about lab values. So yes, they are only the normals, the range are only provided in the case study. So you're right. There are some lab values that you should know. So that one link I gave you, it just talks about the lab values that are most often covered by NCLEX. And also under the test plan, it does look under reduction of risk potential. I believe that's where it talks about, that's the type of questions you're going to get lab values with. Know like the basics, right? Know an ABG, know a chemistry, know a CBC. Those are the big ones, like electrolytes. So you know, no sodium, potassium, and kind of come up with some tips and tricks that work for you to just remember that. That's one of those things that's one of the few things you just really have to memorize, unfortunately. The University of Maryland, Baltimore's free case studies, do they come with answers? They do not. There's a faculty accessible version that can be printed out that faculty can use, but for ones that we use, you know, to teach and assign to students, there's basically how I would use that as a faculty member is I would send you that link. I would have you do that assignment, and then you would download the PDF with all your responses, and then you would submit it to me. Or we could do this is something that we could do in class. I did point you to the mini review, but I would say to use that as kind of your way to, if there's something confusing and you're like, wow, this might be a gap for me, then let that be something that sends you back into your textbook, your study materials to review.
And I see Mary's question. If you are faculty, you can email me directly and we'll send you the link for the faculty. But we have strict instructions not to share that link just because we don't want the students to have the answers. This is something that's supposed to be for class. So I'm going to put my
Yes.
email in the chat, and if you can email me, I'll send you the link.
Thank you.
Okay, any other questions while we still have our trainers on? Okay, well, I just want to thank all of you so much for attending today. I want to thank Carrie for this presentation, all of our other NCLEX trainers, Marian Zavala, Mary Martin. If you're on the call, if you're dean or faculty and you're interested in a training with one of our NCLEX trainers, please visit our website. All of their bios, contact information, all of that is available for you to reach out to them and discuss scheduling and all of things like that. We also, of course, encourage you to reach out to us, the campaign, get to know what we do a little bit more, learn more about our engagement around nursing and mentoring and things like that. Sign up for our newsletter, but we are always here to help and be a resource to you as well. We typically work with deans and faculty, but this is our first time kind of doing something specifically for the students. So students, it's okay for you to reach out to us as well if there's a need, and we can always find a way and a resource to help you. So thank you so much, and we appreciate you guys giving us your time, and I will get that link out to you on Monday.
Thank you, everyone.
All right, have a great day.